Great. Hello, everyone. Hopefully you can hear me well. My name is Matthew Kusin. I'm the Senior Technical Officer with Health Equity Matters as part of the Skip It To team. And we're really happy to welcome everyone here today as part of this webinar. So today's webinar is hosted by the Skip It To program, which is the Sustainability of HIV Services for Key Population in Asia as part of our learning series. And our learning series is really to build knowledge and promote learning across the region around the sustainability of HIV services for key population. And today we have a wonderful group of panelists from different organizations across the region. We'll be speaking a bit more around trans and gender affirming healthcare, and specifically a spotlight on Asia and specific needs from this region. And so overall today, we really want to provide some examples of good practices of community-led service delivery for trans and gender affirming care, a bit about what is transgender and gender affirming care, increase the awareness of specific issues from across the region. So we'll hear from some panelists later about specific country examples and country context from across the region for trans and gender affirming healthcare, from trans activists who are community leaders themselves working for a variety of organizations, and also just to sensitize issues and challenges related to healthcare, as well as policy and regulatory barriers that are influencing, barriers to care. And so just a few housekeeping items. There will be some time for Q&A later on for the session, and feel free to write your questions in the chat, and our panelists or our speakers will be able to answer it afterwards. In terms of the participant list, if you could please rename your name in the chat as your name, your organization, as well as your country. We'll also be sharing the recording as well as any presentations later on. And next, I will introduce our first speaker. So first, we have Marley Gutierrez, who is working for the Asia Pacific Transgender Network. We'll be speaking a bit more about their work, as well as some general overview around trans and gender affirming healthcare across the region from some of their partners. So without further ado, I'd like to welcome Marley to share her presentation.
Hi, everyone. Can you hear me okay?
Yes, and please, everyone else, if you can also mute your microphones while the speaker is speaking. But we can hear you well.
And I'll also share the presentation from my end.
Yes, that's great. If you have any issues, let me know.
Okay. Okay, hi everyone. So my name is Marley and I work with Asia Pacific Transgender Network. I am a project officer and I am actually stepping in for my, oops, sorry, that's the wrong one. Stepping in for my colleague, Pinisha today. And I'm going to discuss a little bit about the APTN tool for the transgender community-based monitoring, which we've rolled out over the past 2 years and have piloted in 11 countries as a form of, providing feedback from communities to healthcare providers on health care, accessibility, affordability, and equity. So first and foremost, the tools that we developed from the TransComp CEM tools were developed with a number of considerations, including the fact that trans people experience substantial health disparities and obstacles to accessing appropriate healthcare services, and these result in poor health outcomes. Trans people play a critical role in educating healthcare workers in how to provide appropriate quality healthcare. And one part of the capacity building process is community-based and community-led monitoring. So community-based monitoring has immense value in that it can not only provide insight into the kinds of information important to the community itself, but also ensure that community ownership over the data collected and processes involved. throughout each stage of the CBM, trans people were the study leads, study designers, and study data collectors. And there were 4 points in each region, which maybe someone will speak about later. But in the TransComp CBM tool pilot, community members were also involved in ensuring the accuracy of data collected and in analysis. So as I mentioned, we've launched this in 11 countries now. For part 1, we did Laos, Mongolia, Papua New Guinea, Philippines, Nepal, Sri Lanka, and Thailand. And we just finished wrapping up 3 other countries. And we will be having some presentations on those countries actually in the beginning of March. And that is India, Cambodia, and Indonesia. So let me know if you're interested in attending those. Trans-competent care means providing healthcare that understands and respects trans individuals with both cultural and clinical competence. Cultural competence involves effectively communicating and interacting with trans people in a compassionate, non-judgmental way, free of stigma. And clinical competence includes proficiency in addressing gender-affirming healthcare needs and applying preventive measures tailored to trans people. So to begin, for each country, to begin with this, we conducted a mapping exercise to see what services are available, what health care clinics, hospitals people actually do go to, and got some data gathering to see what was available, what was accessible, who actually people went to, and then the price of things that were available. So, and then from this, we developed 4 separate parts for 2 separate audiences. One is for the trans community. There was the TransComp CBM scorecard and Excel spreadsheet. And then for service providers, there's a TransComp provider checklist and action plan. So this is an example of the mapping that we did in one of the countries, where we covered different topics to see what was available, what was free. And ideally, this is something that we would like to have like online and on web, because like when we've shared some of these tools, things are constantly changing with the landscape of what is available, what is covered by government, what is covered by other programs. So some of these can be out of date even, within the year. Okay, so for the TransComp CBM tool, we had 6 themes, which was clinic experience, provider experience, health services, HIV prevention, testing treatment, STI diagnostics, gender affirming care, mental health, and harm reduction. And then there was a post-service reflection. So for each relevant indicator, the data gatherer rates their experiences by choosing an emoticon reflecting their opinion of the service that they accessed. So here, I'll show you an example of the scorecard. So this is an example, and we had about 40 different questions based on those different themes. And then in the end, people were able to provide more actual detail about what their experience was. For each country, we had a minimum of 30 people that access different services, so in different key areas. So at least each country had 30 responses identifying different clinic experiences. So following the feedback and data gathering, we did develop some tools to just identify some sort of classifications as to what the health access and availability is like in each country. So we defined that as bronze, silver, or gold standard, and they're just to serve as guidelines for providing insight into service gaps, limitations, and opportunities for improvements. This is just a general indication of establishing categories to see what kind of skills and services there are that can continue to be strengthened and developed as the clinics are moving towards becoming trans competent. So we use this not as a criticism, but rather as parameters for establishing capacity building needs. And then as part of this process, we created the tools for the service provider themselves, which is an action plan that can map out solutions wherever possible to mitigate issues raised or identify use in the CBM tool and feedback. So for the Transcomp provider checklist tool, it was designed for use by service providers. The objectives of this tool are to the healthcare worker and institution to take stock of the enabling factors and progress of the clinic or organization and the steps they can take towards becoming trans competent. The checklist is divided into two sections: improving clinic experience and improving provision of health services. And this is an example of questions. And then this is an example of like following, you know, whatever the health clinic or provider suggested. This, based on their score, this is an action plan which they could immediately take into like next steps for consideration to implement in their clinic or education. So as I mentioned, we rolled this out in 11 countries. Here's the process where we engaged focal points and data gatherers in each country. Translation of tools. We had a video to show the focal points and service providers about how to, you know, fill in and to look at and provide a review on their experience at the clinic. And then there was some data gathering and analysis. And then for every country, there's been an online dissemination meeting of the country specific findings, because we have identified this by country and then compiled it. So this is just, so now I'll provide a little information about the overall findings from these places that we've found. Okay, so here's overall findings from the CBM from the first countries that we piloted in part 1. I am compiling the part 2 ones, so I will have that later. But overall findings include that reported incidences of misgendering, particularly by facility support staff, and oftentimes inappropriate line of questioning. So oftentimes people went in and received questions that were completely irrelevant to the health need that they were seeking guidance for. And 20% of people said that they were not given the choice to use their preferred name or pronoun, whereas 1/3 of people noted that there was a lack of informed consent and explanation of their rights as a patient client. So there was a need for gender sensitivity training. Only 30% said that their information needs were met. And then some key areas of gaps identified were stigma and discrimination, where discrimination was compounded when a transgender person's identity or expression did not match their identification card or documents and/or bodily diversity. A number of data gatherers expressed concern about their personal welfare and felt unsafe when presenting at certain facilities. There was also a lack of knowledge of gender-affirming care by the health providers themselves. So trans healthcare services in many countries of the region are not covered in education or by universal health coverage schemes and mechanisms. So there was just an overall lack of knowledge by healthcare providers. And often, as I said in the beginning, the trans people had to explain or provide the healthcare professional with their own experience and expertise instead, and there was a learning opportunity for the healthcare provider, but that's not why the person came in to seek treatments. And then, yeah, here are some quotes from people about their experience of feeling unsafe when attending the clinics. And it ranged from everything from, you know, from waiting in the waiting room to restroom to seeing the doctor in the line of questioning. And then trans healthcare services in many countries are not covered by universal healthcare coverage. So there was a large issue of affordability, but then what was really helpful for people was that mapping that we did to see the areas in which what was covered, what was available, and how that might change. So overall, our tool can contribute to existing monitoring efforts related to quality of care, testing results, and treatment. And we hope that they can be integrated by both communities and also healthcare institutions to help have consistent monitoring. Yeah, and I think the next step that we're doing is trying to include and speak with healthcare providers and institutions for those that already have some sort of monitoring and feedback mechanism to see how we can integrate it into that, and that the institutions will actually then have more impetus to respond to, you know, feedback that is negative or to the gaps in their knowledge. So yeah, I do have country reports if anybody has any questions, but I think that there are people here that speak directly to this and their country findings as well. So now I will hand it over. Thank you so much for having me.
Great. Thank you so much, Marley, for that fabulous presentation and giving an overview of some of the challenges from across the region. So I think we will go on to our next presentation, and then afterwards we'll have a bit of a pause for some Q&A specifically related to both Marley as well as Kunjama's presentation. And then we can go into our panel discussion hosted by Abina. And so next up, we have Gemma Samatapal, who is working for the Tangerine Clinic as part of IHRI, and she'll give a program overview around gender-affirming and hormone therapy care. Specifically from Tangerine's perspective, they're really a leader in this area, and everyone from across the region is always talking about how fabulous the work they're doing. And it's kind of like the gold standard, let's say, from this region around this kind of care. And so over to you, Gemma.
Thank you very much, Matthew, and good morning, everyone. Please allow me to discuss and share my experience working at the Transgender Clinic with you this morning. And I'm going to be talking and sharing with you about the program overview and gender-affirming hormone therapy and other kind of works that we do at Transgender Clinic. And if anyone has any questions, please feel free to leave your questions in the chat box, and I will get back to the question later. Thank you. So first of all, let me quickly introduce our organization first. Our organization is actually called the Institute of HIV Research and Innovation, or IHRI. And as the name would imply to you, that we work on researches, especially on HIV and any related health issues around HIV as well. And the reason why we opened the Tangerine Clinic back in 2015 was that we had this information, as you can see on the slide. I'm quite sure some of you would be quite familiar with this information. So back then, this information, which is still available and still exists until this day, it shows that the transgender women is considered one of the key affected population who has the substantial risk of acquiring HIV infection. And among these key population here, you can see that the transgender women, on the left-hand side here, they also have the highest risk among the other groups as well, which is mainly based on the stigma and discrimination and the barriers to get access to the healthcare services. And when we're quite lucky that in Thailand we have the estimated population size of the transgender women from the information from the Ministry of Public Health, And the Ministry of Public Health here in Thailand, they estimated that there would be more than 300,000 transgender women in Thailand, which I personally think it can be quite underreported. But anyway, this is the figure that we have to start with. And for this amount of the transgender women that we have here in Thailand, we found that about 17.3% of the transgender women, 17.3% is a median HIV prevalence among them, which is extremely high. The other thing is that if you look at the human rights and legal protection situation here in Thailand, you see that I mean, even if lots of people thought that Thailand is the paradise for LGBT person, for trans people, but then again, that legal gender recognition law is still not in place in Thailand, which means that any transgender person cannot change their gender marker. And that also links to the lack of the proper health policy for transgender people. So we are actually not visible through the eye of the National Health Security Office. And when you look at the transgender people, where we don't have any proper health policy, as part of the national health policy. If you look at these two topics here, number one, talking about the access to healthcare in general, we do have the universal health coverage system here in Thailand, which trans people can get access to. But then again, because we still don't have any proper transgender healthcare policy, so even if we can get access to all the, healthcare in general, but then again, it wouldn't be very, very friendly. And if you look at number two here, because again, there's no proper healthcare policy for trans people, so the access to gender-affirming related healthcare is zero. So basically, if you're a trans person here in Thailand, and if you want to get access to any gender-affirming related healthcare, you need to find your own way to get to the services. And another thing is that you're going to have to pay, all the fees out of your own pocket, and mostly all the facilities or the gender clinics would be only in Bangkok or in a big city in Thailand. Okay, and if you look at the stigma and discrimination situation here in Thailand, you will find here that most of the, almost half of the transgender people here in Thailand, they never see a doctor. They never get any services on the gender-affirming healthcare. And then again, almost half of the trans people here in Thailand as well, that, they went to the hospital and they had negative experiences from healthcare providers. And also, this is quite sad because 15% of the healthcare service providers admitted that they have negative attitude toward the transgender women who had any HIV related issues around it. So this is the situation why we need to open tangerine clinic. So we held the community consultation back in September 2015 to actually speak to the community, to the representative and the stakeholders, to share the issues that we were facing and see, how can we address the issue together. And then from that consultation, we had a suggestion from the stakeholders, from the representative of the communities. And the suggestion were that we need to open, if we need to open a clinic, we shouldn't open an HIV clinic for trans people. We should open a one-stop service, holistic services clinic for transgender people. And according to the community representative, they suggested that even though HIV seems to be one of the urgent health issues, but then again, the priority, the first priority of that health issues would be access to gender-affirming healthcare. So again, the community suggested that we should open the clinic and position the gender-affirming healthcare as the main attraction for the community, because this is one of the most priority, the most sought after services from the trans people. So we opened the clinic back in November 2015, and this is our 9 years already. And you see that also, according to the community, they wanted us to have trans leadership and also the trans staff. So here, as you can see, on the slide that we have trans leadership like Miss Rina, she's not here today, and also myself, and we also have trans counselor as well working with us. Okay, now let's have a look at what kind of services that we provide right now. You look at the top left here, which is the hormone services. As I mentioned earlier, this is the most sought after services among the transgender clients that come to see us. This is their first priority. So talking about hormone services, we do two things here. If you've never been on hormone before at all, we can start or initiate hormone for you safely. And if you are already on hormone, we can help you to reshape your regimen and to plan for the health monitoring plan for you. And right now we offer the hormone service counseling for free, and also the hormone level checkup is free as well. On the right hand side here would be the sexual health services, which basically about HIV and sexually transmitted infection, all kinds of services. And our main principle here is that if you come to the clinic, we want everything to be done in one visit or in same day. For example, if you come to the clinic and you find out to be HIV positive, then we can offer the treatment on the same visit on the same day. So it means that if you meet all the health criteria, you can get the medication and take the medication back home on the same day. And that the same thing applies to the any kind of STI like syphilis, gonorrhea, chlamydia as well. And as you can see on the screen here, that apart from general sexual health services, we also have trans-specific like a high resolution neovaginoscopy as well, which means that we have a high resolution camera that the doctor can use it to check up in the neovagina for the transgender women that already had the genital surgery. We also have the neovagina care, which means that we offer post-operative care and counseling and services to ensure that your neovagina is healthy and you are in the well-being state. Saying this, we also have the surgeon coming into the clinic every Tuesday to perform all the checkup for the trans people. The good thing about the sexual health service and the neovagina care at the Tangerine Clinic is that if you come to the Tangerine Clinic, you can have 3 different checkups for the neovagina in one visit. First, we can check for the appearance of the neovagina, let's say the cosmetic look. Second, we can check with the neovagina functioning, if it works fine for you. And the third is that we can check for any sign of sexually transmitted infection or abnormality inside of the neovagina, which you need to have a trained doctor to be able to perform this. And with our facility, you can get all these services in one stop. And also with the mental health and well-being on the bottom left here, you will see that we have peer counseling because we have trans staff. We have psychosocial intervention, psychiatric medication. And when we say peer counseling or transgender counselor, it doesn't mean that if you're not trans person, you cannot work well in this setting. The principle here is that it's nice, it's good to have a trans, to have a trans staff. But then again, if you are non-trans, you still fine working with us, because the main thing is that at the IHI of Tangerine Clinic, before anyone start working at the clinic or start working at IHI, they all need to take the gender sensitivity class so that they know how to communicate with the transgender people or any LGBT persons correctly without stigma and discrimination. So I think that's the whole point here. And talking about mental health and well-being, we also offer the mental health screening for everyone that comes to see us. And it is a score-based mental health screening. We use the screening called PSQ2 and PSQ9, which has been studied and researched. And we have been working with the psychiatrists to agree that these tools work best and very, very suitable for our setting. So basically, PSQ2 and PSQ9 will be the screening that can detect any sign of depressive symptom or suicidal ideation. And if anyone found out to have a very high scoring, then we can offer the different intervention to address the issues. We also have the psychiatrist coming in once or twice a month to see those who need to see the psychiatrist right at the Tangerine Clinic. We can also do minor gender affirming surgery like eyes, nose job, chin, and for transgender women that have genital surgery, if you need a bit of a touch up for your vagina, it can be done at the clinic. For transgender men that already have their chest removed, and if they have any issues about the size of their nipple, we can do the size reduction here as well. And this is our performance so far. This is the data up to May last year. You will see that right now we're taking care of more than 6,000 transgender people altogether. And to get the most updated right now, we serve more than 6,000 transgender women alone. And even though the most sought after service would be gender affirming hormone services, but then again, we were successfully link people to get HIV testing at more than 90%. And if you can see here that we found about 9 to 10% of the people to be HIV positive. And these include those who are HIV first-time tester as well. And from this, we can link them up with treatment and prevention as well. Okay, now let's quickly look on the demographics of the transgender women client here so that we can see that, what are the trends of the health issue, what are the things that we need to do on the next step. For example, we found that 11% of our clients use amphetamine type stimulants, which means that we need to be sure that we can actually offer them the services that could maybe support them if they use any sexualized or non-sexualized use or chemsex. Would there be any support that they need? This is something that we need to work and offer. And also we see here that 14% of our clients are engaging in sex work, which means that we have to be sure that these 14% people can get access to condom and gel and PrEP if they need. And also you will see here that 8% of our clients are non-Thai as well. So how can we support these clients that coming from the other countries? And also you will see here that more than 31% of our clients also have the depressive symptoms as well. That's why we have to pay attention into the mental health and well-being of our clients. Okay, we do not seem to have a lot of transgender men, but we have new people coming in more and more. Right now, we have much more of what you can see on the slides. And so far, we just found the first case of transgender men who found to be HIV positive this year. And we are paying very, very high attention to this. And we are working very hard to see what can be done to help the more specific or anything that we can do to reach out to the high risk or harder to reach transgender men who might be at risk of HIV, acquiring HIV. Okay, and if you quickly look on this, I'll just put together all the information about the young people that come into Tangerine Clinic. You will see that up to May last year again, we found that from more than 6,000 people that come to Tangerine Clinic, almost 3,000 or almost half of them are the people between the age of 18 to 24. And then among these people that got HIV testing, we found that about 7% of them to be HIV positive. That means we need to pay attention on the young people as well. And if you look at the sexually transmitted infection like syphilis among the young trans people, we didn't find a lot on syphilis, but we found a lot on chlamydia here, especially among transgender women. You see that of all the people that got the chlamydia testing, we found 22% to be reactive with the chlamydia and gonorrhea. That means that we need to maybe paying more attention or a lot of attention, or need to design a more youth-friendly service to the young transgender people as well. We also have people that use sexualized and non-sexualized drug use as well. As you can see here that according to our data that we collect between April 2021 to March last year, we found that of all the people at that time, like more than 1,600 something, 88 of the people, or 5% of those people admitted they used the substance, and 34 of them, or about 38 or 39%, admitted that they use the drug that associated with their sexual activity or chemsex. And we found that those people that engage in sexualized substance use or chemsex associate with those engaged in sex work, with those who use PrEP, or with those who living with HIV as well. And we also found that many of them face many socio-economic issues, and many of them even had attempt to reduce the use of chemsex. So this is something that we're paying attention on as well. And this is the HIV self-test that we conducted so far, and we found that HIV self-test could be one of the game changer in terms of reaching out to the high risk transgender people, or people that are unable to travel to the clinic. As you can see here, that of all the people that we offer the HIV self-test, we found about 5 to 6% to be HIV positive confirmed. Okay, so we talk about gender-affirming healthcare integrated with the HIV and STI services a lot. It was a suggestion and recommendation coming from the community. So that's why we integrated the gender-affirming healthcare into our services at the first place. But then again, after years and years of working, we have already found the analysis and the proof that these are all the publications that have the proof that adding or integrating the gender-affirming healthcare into your HIV and STI services could actually increase the uptake of HIV and STI services. Apart from that, it would retain the clients into your system as well. So it works with the proof. That's the evidence to support it. And that is why it could be the model that you can apply to your setting or your country. Okay, now let's talking about Tangerine Academy, which is another program for from the Tangerine Clinic, which is about the technical assistant here. And you will see that with our program, that the Tangerine Academy here, we do 3 different things. We do apprenticeship, we do on-site technical assistant, we do dynamic learning hub here. For example, with the apprenticeship, you can come to the clinic and do your apprenticeship, or staying with us for five days, a week, or a month, to do your apprenticeship. And we have already done that through so many different organizations and community health workers. We also do the on-site technical assistance as well, which means that we also go to your sites. We have been conducting that with Vietnam, Philippines. We also work with Sri Lanka in the last 2 years. And in the last 2 or 3 years, there was already a training and a plan to open a clinic called Patuma Center. But as far as I know, it's still on hold, which I'm very happy to actually carry on with this. If you have any representative from Sri Lanka today, we can maybe reconnect and start the work again. Okay. And we also do the on-site technical assistant in the regional level as well. In this photo here, it was myself and the team, in Vietnam, because we've been working with Vietnam quite a lot, and also with Myanmar as well. And this year we will be carry on working with Myanmar, and I suppose we'll be working with Laos as well, and Indonesia, of course. Apart from that, we also have developed the Transgender Healthcare Services handbook here, as you can see here. This is because, you can see it. This is because when we first opened the clinic, we only use the international guideline as a service protocol. But then again, we found that there's a lot of limitation on that. So we developed this Transgender Healthcare Services handbook with the Faculty of Medicine, Chulalongkorn University, so that we can tailor all the service based on our experiences, and tailor all the service and the guideline that specifically for the people in this region. We also developed a Trans Health 101, which is the online self-learning course. I'm going to type in the link into the chat box later. So if you want to find out about this course, this is open for free. So basically, this is a very good course if you work with the transgender community, especially in transgender health and HIV as well. Okay. Next one, this is the counseling tool for gender-affirming hormone treatment for transgender and non-binary people. I have it in my hand here. I don't think you can see it. If you can see on the screen, it's actually a tool. I mean, like lots of people say, or lots of people do not actually have any access to guideline or any knowledge or information about gender-affirming hormone treatment, like what kind of hormones should be recommended, what are the doses, what would be the health monitoring plan. We have it all, in this counseling tool. So in this counseling tool, we have all the information for you to be able to give the counseling for anyone at all, like for a transgender woman who already have genital surgery, transgender women who did not have genital surgery, non-binary people, transgender man, everything is in here. And it comes, with the photos of the recommended, internationally recommended medication with the dosage as well, and the brand and everything. And you also have the information on the target hormone level that you should have while you are on hormone medication. We also provide any other related health checkups that you would need while you're on hormone, because lots of people have concern about cancer screening, about osteoporosis, prolactin, and any other health concern. They're all in this counseling tool. We also do researches as well. Right now we do 1, 2, 3, 4, 5, 6, actually like much more than this, but the highlight would be the IFAC and IMAC research, would be the research on direct interaction between PrEP and hormone medication like feminizing hormone or masculinizing hormone. And the lenacapavir is the long-acting injectable PrEP for trans people. This one is a very good and very exciting research, because if this one is successful, it means that we're going to have a long-acting injectable PrEP that lasts for 6 months' time for just one injection, and that will be applicable with the transgender people as well. We also do C-Trans, which is a cohort study that we work between 3 countries, Thailand, Vietnam, and the Philippines. And the T-Rex study is about to launch, hopefully next month. This is the study about a pre-implementation study to develop the trans-tailor service for transgender person that use chemsex. Okay, and talking about our challenges, the main challenges would be back to the health policy, because there's no health policy, there's no proper health policy for transgender people in Thailand. There's no universal health coverage that cover the gender-affirming healthcare for the trans people in Thailand. So we use the data-driven policy change by submitting our proposal to the Ministry of Public Health back in 2020, using all the data that we collect from the Tangerine Clinic to show them that there's a need for the access to gender-affirming healthcare for the trans people, and providing or integrate the gender-affirming healthcare into national health coverage will be a good investment and would actually prevent many of the trans people from having their risk of using the hormone medication on their own or self-medication. And it is the worth, and it's worth the money, worth the investment. So we have already done that. And we quite lucky that with all the information and the data, the evidences that we submitted, the Ministry of Public Health accepted all the proposal. And right now they have been working internally, and we just been notified by the representative of the Ministry of Public Health that they wanted to prioritize adding the gender-affirming healthcare into the national health coverage this year. And they were saying that they would want to be able to finalize all the process by June this year. And during this process, we were engaged with the representative from the Ministry of Public Health to actually share all the data and evidence or any information about transgender health through the Tangerine Clinic data, and through all the health of the local of the local civil society organization that work with the transgender community and the LGBT community as well. And also,
Gemma, I
this
think
is
we
one of
need
the
to
yes.
wrap up. I think we need to
Okay.
wrap up if it's okay.
Thank you. This is my last slide. Yeah. Okay. So if we have the universal health coverage here, the thing is that we also need to work with the regulation about the medical regulation in gender-affirming services. And if you can see on the slide very quickly here, we do have that kind of guideline for the medical health service for gender-affirming healthcare here in Thailand. But then again, it has been really, very, really outdated. And we've been working with the Medical Council of Thailand to do the revision of the regulation, and we suppose that the new edition of the guideline will be out next year, and that will give us the more flexibility and the more access to gender-affirming health services, and we want it to be like the primary care approach. Thank you very much. Thank you.
Great. Thank you so much, Gemma, for the fabulous presentation and giving us, a very clear overview of your program and, some of the challenges as well as a lot of the successes, which is fabulous. And I know a lot of people are very eager to learn from you. So in terms of any questions for Gemma or Marley, if you can maybe write those in the chat if you have them and tag Marley and Gemma, and they will be able to answer in the chat box. So next up, I will hand over to Abina here, who is working with AppCom, and she will be moderating this next panel, as well as introducing all of our panelists. So over to you, Abina.
Thank you. Thank you so much, Matthew. And the first question that I had, Gemma, that when are you coming to India? No, fantastic. I think both the work that Dr. Gemma, you have presented and Mali, you have presented is a very substantial work. Just wanted to initiate this discussion of the panel. 19% of the entire world population of transgender lives in Asia-Pacific countries. Asia-Pacific countries are the majority of countries which has a huge diversity among transgender people from the perspective of intersectionality, from the perspective of gender expressions, and also from the perspective of criminalization, vulnerability, and various other aspects that are impacting to the transgender community immensely. Today, we have a very special panel discussions that is going to highlight on what are the challenges that we are right now facing on delivering quality and dignified trans health. This is a very, very important discussions because that is even the UNAIDS report has highlighted substantially that a lot of people are not dying because of lack of health services. They are dying because of stigma that is killing them. Mental health, other issues that are really impacting their HIV status and HIV access among various countries in Asia Pacific. And today we are going to have a discussions, a lot of country context examples and regional examples from the wonderful, wonderful panel that I have right now. I have 3 panelists, which are amazing ladies from a different countries. One is Miss Angela. Miss Angel is from Sri Lanka, and she's part of the Jaffna Transgender Network. Welcome, Angel. Then we have Bella Orobri. She's from Indonesia, and she's from Inti Munda organization. And third, we have icon actually for the Asia Pacific region, Manisha Dakal, who has been a torchbearer of transgender movement, LGBTI movement in Asia Pacific region. She was involved with ILGA Asia, and also she is right now associated with Blue Diamond Society, which is a fantastic organization working on LGBTI work in Nepal. So welcome everybody. Welcome to this fantastic discussions. This is really amazing because all you young 3 ladies are extremely inspiring to the communities. And what I request you is that, please bring in all the examples, because we have right now more than 100 participants who are listening to your talk. they look up to the work that you guys are doing, and we are really, really looking forward for a rich discussions that can come out with this discussion. So, with moving forward with the discussion, Manisha, let me just bring you in this discussion. Would you like to sort of articulate the major changes that you have which you have observed in the health needs of the transgender community in last decade, because you have been working tirelessly for transgender community in the region. What are the changes that you have seen in the Asia Pacific region, and how would you like to articulate the progress or regress regarding trans health?
Yeah, thank you, Avina. Thank you, Avina. First, thank you, Avina. First, I would like to share, I'd like to start my own story. You can imagine how painful during the waxing process to remove the facial hair. I did facial waxing many times in beauty parlors to remove my facial hair in Kathmandu, and it was so painful. I did many, many times because we didn't have any alternatives at that time. And I heard about the laser clinic, but at that time we didn't have such facilities and such informations in Nepal. And it was, I recall, it was 2006, 7 or 8 when I got the opportunity to participate in Risk and Responsibility Conference in New Delhi and different other HIV related program in Thailand. And I was so concerned on my facial hair. And at that time, I spent US $100 per one session through my saving from my per diem and allowances to remove my facial hair in the clinic in the Bangkok. So in addition, during the Alga Asia conference in Chiang Mai many years before, I got the support from my local Thai transgender sisters who helped me to buy the hormones from the local pharmacy. And I bought hormones for me to Nepal. And I didn't know about the importance of the doctor, proper supervision from the doctors, but only I'm concerned at that time on my feminization process only. And I received this kind of services whenever I went to Bangkok or in India. And as an activist, I continues to talk with at that time I hate the beauty parlors and the some clinic and hospital and some concerned stakeholders, uh telling them that the why not you bring these kind of services in Nepal. And then in last decade, as per your question, that I would say we success to bring somewhat extend services in Nepal. I would say not 100%, but somewhat extend. Now we collaborated with the Family Planning Association Nepal to establish the hormone counseling clinic with the proper supervision from the endocrinologist, and there is a mental health expert in that clinic. Thanks a lot to the team of Tangerine Clinic, Gemma, Rina, and the team from Asia Pacific Transgender Network, who play a significant role to establish the such hormone counseling clinic in Nepal. That is the first time. Now we have so many laser clinic, hair remover clinic. I don't need to go Bangkok and India and expense my huge money. We can do the breast implantation in Nepal, and we have the HIV service delivery led and driven by our own community. And we started to dispense the ARV medicine from our own clinic, and we integrated the PrEP services, mental health services, and STI related services through our intervention. Now, the transgender man and transgender woman are accessing the hormone with the counseling from the medical persons. Before, it was not like that. I got the hormone from my elders, and other also got, they through the same process. Like I bring the hormone to my country and I distribute to my friends. That is not the proper and good way. Later on, we create the awareness on that, and we establish the trans-friendly clinic with the promises of Family Planning Association Nepal. Now, some changes we can see, but still it is limited. It's not decentralized, and we don't have the sex reassignment service right now, and it is very difficult for the transgender man to do the top surgery here. So these are the some, the changes from that time to now. We can see some progress, but still need to be done, Abhinav.
Yeah, men, women, gender affirmation care, especially for young trans women, are extremely important. And I remember going with you around the medical shops in Nana and other places, and buying cheap hormones for our country people. Those were the days. But I'm happy that in some of the countries now, hormone treatment is available, laser treatment is available, surgical interventions are available. I have a supporting question, Manisha, for you. This you spoke about gender affirmation care support, right? But what about social inclusion? What about human rights? What about criminalization? Has there been any change in the last 10 years that you have seen for transgender people?
For us, the from the government side, we have the provision for the citizenship for the non-binary peoples and others category, and the for later on we advocate for the transgender perspective also. For some transgender person who identify as a woman and who identify as a man, there should be the provision for to identify it as a man and woman as well, including the non-binary option. So government is ready, and the our brother and sister, they are accessing the citizenship certificate as per their self-determination. But still, you do need the challenges in to access the legal gender recognition certificate. There is a medicalization. The government require the medical certificate that is ultimately sex reassignment surgery. We need to show that proof to access our citizenship. So it's not the, the with the principle of self-determination is not the human right perspective way, I would say, and we are still advocating for that. And government is saying that we are doing a very good job to providing the citizenship issues, but they are lacking on the human right principle to include in their provisions to access the citizenship of enough.
Thank you, Manisha. That was really wonderful. Angel and Bella, both of you represent young trans people, right? You represent the Gen Z trans people, and we are so proud to have you here. I think the leadership should be there among young trans people to taking forward this aspect. I have a specific question for both of you regarding policy. So Manisha just spoke about the legal hassles that transgender people are still facing. Still, we are not liberated. Still, we have issues in your countries, Angel and Bella. What are the policy challenges that you are facing for the transgender young trans people? Maybe Angel can
Um,
go start and then Bella can join. Thank you.
yes, the Sri Lanka in legal, illegal in LGBTQ in Sri Lanka. So now some parliament in area and the voting now process, but in health is the major changing the Ministry of Health in Sri Lanka and gender recognition certificate in 2016. So this is the change in name and gender in the birth certificate. This is the best woman. My gender starting in the 2014, my hormone and this is the best woman in changing significant women in Sri Lanka. So um, starting period in clinic available in only Colombo. Now some regional level. This is the Jaffna, my part Jaffna, Candy, and Batiklo. So this is now improvement health care services. One of the women in Jaffna, my Jaffna is very culture barrier in transgender and LGBT community. So one of the surgery in SR surgery in transgender women 2020 in the COVID period, the free, not payment, it's the free. So Sri Lankan healthcare, the free services, but not system is not sensitive and supportive the transgender community and some legal issues in Sri Lanka in other law is penal code 399 the penal code in Sri Lanka without cheating by persons with transgender liberty punishment of 3 years. Something other cases, some transgender people occupied some cases, so available in Sri Lanka. But it's a clinic and the health system is now improvement in Sri Lanka because it's good. But the economical problem in Sri Lanka now, the hormone. Other medical hair is high expensive. So go to other side in Asia, surgery or something in India or Thailand for the transgender people. Trans women, trans men, the only available the top surgery and bottom surgery is not full success in Sri Lanka. So
Thank you. We're still facing the challenges with the legal perspective. I've just come back from Sri Lanka, and I'm glad that you guys are already working towards, decriminalization of same sex. And there are a lot of petitions which has been filed. And I saw fantastic young trans community members who were like ready to make some changes. Bella, what about your country? What is your experience?
Yeah, so far, the new health law, so Indonesia has a new health law, it produced last year that address reconstructive and aesthetic plastic surgery, which state reconstructive and aesthetic plastic surgery to change sex can be performed as long as it is for the adjustment of the genital to the actual sex. So we are in the process of advocating this to the Ministry of Health to find out more, because from this statement, it can be interpreted that plastic surgery to be change sex is intent only for intersex, but not for transgender. So currently, we will make sure this is clearer so that the regulation related gender affirming care are also clear. But in addition, we are also trying to oversee the ratification of the anti-discrimination law, this is very important and will contribute a lot of to access to non-discriminatory health services, because it's really hard to push the government to legal this anti-discrimination law. So yeah, that's Indonesian situation, Abhina.
Great, fantastic. So one of the things that I was curious to ask all the three of you, mental health, right? Me and Manisha spent countless hours talking about mental health, how it impacts our love life, how it impacts our access to health. What do you think about what are the facilities that needs to be provided on mental health for transgender people?
So, Avina, I just got the one news from the another province of Nepal. One transgender sister suicide just today, this morning, because of the mental health issues. So, the mental health issues, we need to integrate the services in our broader HIV service delivery program, and this is very important. And not only for the our transgender community, but also for the service provider, for the activist, because the Nowadays, because of these so many things is happening, our own work, our family issues, our relationship issues, our office work, our project work, our activism and movement, these all the issues when comes together, then the activist and the human right defender service providers also need the support on the mental health issues. And we created that services in integration with the HIV service delivery program. And like in your country, you have the Garima Griha, for the respect home. In your countries, and like in Nepal, we established the respect home to serve the community who face the gender-based violence survivor, and for the mental health support to link them in the mental health. So mental health issues is a big, the challenges in our community, and we need to create the more support, more investment on the mental health support.
Thank you. Bella and Angel, I wanted to ask you for young people especially, right? We are doing a lot of HIV programming. What do you think how the programming should be done for transgender people, young transgender people? What needs to be done for the HIV programming? Maybe Bella can start and Angel can finish. Thank you.
Okay, so Indonesia is currently in an election year, and tomorrow is the election day, and there will be a new president elected, and we have to ensure their commitment to intersectionality in all aspects, especially in HIV treatment for transgender. Then we are as a community, the step that needs to be done is to always guard and advocate for intersectionality in this case. Beside that, what we need is also involve all people, all transgender, all young people, to involve and ensure in intersectionality. So, and Intimate has currently made initiative to gather organization led by young people across issues such as like disability, labor, environment. So we want to make sure that they will know about trans community, and we will know about labor issue, environment issue, and disability issue. And for HIV treatment with young people, there should be integrating health services like Manisha said. It's really important because like mental issue is also collaborate with HIV services. And also the important thing is there should be sexual violence services, because like some young transgender get sexual violence from their partner or from their client if the transgender is the sex worker, because that is really important. And also gender-affirming care, because in Indonesia it's quite rare for now, but we still advocate this issue because like some finally access hormone therapy, but in illegal way, like they buy from the drugstore, but they not use that well. They don't know how to use it. They don't know what dose is fit to consume and what side effect that will get from them. So yeah, there had a lot of risks.
So my region in Jaffna, HIV clinic in Aliable, the transgender community. The first time in pilot project starting Jaffna, I'm working HIV project and conduct transgender testing and use the clinic process. Now is working other project in region in Sri Lanka. So transgender community engagement and some barrier in culture barrier. Some people is not go to clinic, something the problem. So but still maintain the clinic process. And doctors is friendly and making the clinic useful.
Great. Thank you. Thank you so much. I just have a last quick question, like a rapid fire for three of you, because we are coming to end of this panel, but I've got this question. I just wanted to throw it out to you. So three important things that you think really that people in Asia Pacific region, stakeholder, policymaker, anybody has to work on with the transgender people on HIV prevention or support. Any three important things that you feel are important to be worked upon? Maybe we can start with Angel this time. Yeah, Angel, three important things you think which are really important to be highlighted.
It's, now Sri Lanka in penal code change very
So
important.
criminalization. So
Yes,
criminalization is one thing.
is
Yes.
main important working now. And
Yeah.
second, in the, now economical problem in Sri Lanka, the by hormone and medical treatment,
That's
high price
fantastic.
and
So you are saying
tax
the financial independence, financial sustainability of transgender people is also very
transport.
important
Yes,
because a lot
very
of transgender
important.
people are living in poverty. Okay. What is
Yes.
the third thing?
Third, in main the free healthcare service in
Free
surgery
health
in available in
services. Yes.
Sri
Gender
Lanka.
affirmation care. Yes. Free gender
Yes.
affirmation care. Health is human right. And I think gender affirmation is part of who we want to be. And that's why these services has to be provided free. Right now, people are providing a lot of money for that. Bella, what about you? What
Ye-
are the three things?
Yeah, so the first one is meaningful engagement of transgender people.
Fantastic.
Yeah,
Fantastic.
that's really important because like we should be go work together to meaningful engagement in every aspect and collaborate in every sector. And also I agree, criminalization is still really important to us, and health access. Yeah,
Health
that's really
access, meaningful engagement, and criminalization. Fantastic, Bella. How fantastic you are. She's a young leader, and Angel is also our Hero Award awardee. So we're so proud to have both of you young girls and more younger girl, Manisha, with me. So what are the three things, Madam?
Yeah, thank you. So demedicalizations to on the
Criminalization.
legal gender recognition, that is one thing, and transgender health need to be considered as a larger public health, the settings and public health policy should, the consider trans health issues. That is another thing. And another is investment. Investment from the government side and the donor side is needed for the better quality services regarding the transgender gender affirming healthcare services.
Thank you, ladies. My God, what a fantastic discussion this has been. So much enriching. And all of you who are from the stakeholders, policymakers, program implementers, or just community members, remember, we are all trans people born free. We are powerful. We are beautiful. We are amazing, and we are going to shine. So make sure that wherever you are, just keep smiling and keep making the wonderful space for other trans people. Thank you so much. Back to you, Matthew.
Great. Thank you so much, Abina, and our wonderful panelists. That was such an enriching and enthusiastic discussion. And so next up, we will hear from Sherry from APNSW with some community reflections.
Hi, hello.
Hi, Sherry, over to you.
Okay, I'm trying to on my camera. Right, okay, I believe you all can see me. Hi, okay, it's really nice to hear from fellow transgender. I myself is a transgender. I'm a Malay Muslim transgender sex worker, and currently I'm the regional coordinator for APNSW, the Asia Pacific Network of Sex Workers Organization. So, in my point of reflection from what I've heard from everyone, I think it's really important to know that there is an intersectional between transgender, in terms of HIV, assessing HIV healthcare, PrEP and PEP, and also transgender doing sex work, and then also transgender assessing hormone replacement therapy. And as an activist myself, I've been doing this for over 10 years now. I realized that nothing is impossible, uh, but your country of origin. I think when you have the strength, have the courage, have the power, you can always fight for this thing. Because I've learned for myself that it does take a big courage from me to really make the issues of transgender part of the movement because I believe right now I think it's fair to say that transgender issues are being overlooked because perhaps they're more focusing on the non-binary, the intersex, but I believe transgender we can always fit in any current issues. For example, when assessing HIV healthcare, then we have transgender sex workers, and we're talking about health assessing health, then we also have transgender that's wants to get hormone replacement therapy. So again, bottom line is all about how you, someone with the power to speak up, someone that is transparent, someone that is known for your passion. I think you really need to know and have different kind of tool and strategy to make all these things possible. Yes, thank you.
Thank you so
Matthew.
much, Sherry. So I will actually open up for the next 5 minutes. If there are any burning questions for any of our panelists as well as speakers, feel free to write in the chat box for the next couple of minutes before I will hand it over to our principal director for some closing remarks. Samuel?
Okay. Good evening, everybody.
Yes, we can hear you. Please go ahead.
Okay. Thank you. I'm from Gempita Foundation from Indonesia. So I very respect to this event. Before I continue I'm sorry, my English not good. Maybe I must try. So I just here follow this event webinar. Only one message to the transgender and gender in my country, Indonesia. The professional, they street busking, or what is the mean? Street musician, yes, musician. They have using drugs. That's my concern. So it's very made me sad because I know they use drugs, and if they get in the police, they have to be jailed, and the police confused to put them in jail in with a woman or I'm very because that's the fact in the field in Indonesia. I'm in Gempita Foundation, but I also in Indonesia Network People of UNICEF or PKNI, but at now I in PKNI just about involved full. So with my organization, and now I want send this message for the transgender and gender, but that issue and the problems in the fact transgender and gender who use drugs. Thank you. That's it.
Great, thank you so much for that question. I don't know if any of the panelists or speakers want to respond around the question around the, emerging issues around drug use and high drug use among transgender women. Are there any respondents from the panelists who want to take this question?
Yeah, for the drug use issues, we are lacking on the data and the informations, and we don't have that information, and we need to advocate for the government and the donors to do this study on the drug uses among the transgender community. That is one thing, and the another thing is services for the transgender people who use drugs. The
Oh, sorry, you went on mute,
to
Manisha.
integrate the services for the transgender people who use drugs in those HIV service delivery intervention. Those things are lacking in our interventions.
Yeah, maybe Matthew, I can also add from my recent Sri Lanka visit. I just feel that within the harm reduction spectrum, I think we still have harm reduction spectrum very much focused on binary. We've not been able to address the issues of transgender community, and transgender communities are extremely vulnerable for substance abuse and also drug use, especially chemsex and other related aspects, because transgender people are majority of trans women especially are surviving on sex work. And I think it's a high time that we have to start talking about intersectionality of preventions for the transgender people within harm reductions and chemsex. I see three important priorities that need to be addressed right now: education, capacity building of healthcare providers, community, appropriate materials for people to get awareness, and third is the inclusivity within the HIV interventions among the harm reductions for specific prevention towards young trans women, trans people who are into drug use. Thank you.
Great, thank you so much, Abina. So I think we'll need to wrap up this panel discussion as well as the Q&A section. So now I'll hand it over to our Principal Director for SKIPA 2 at Health Equity Matters, Felicity Yap, to say a few closing remarks.
Thank you, Matthew, and good afternoon, everybody. Whilst I'm very honoured to be invited to give the closing remarks, frankly, I don't think that there is anything that I can add or say that hasn't been said more eloquently than our amazing panelists of speakers who shared their lived experiences and their insights with great dignity. Many takeaway messages, and it's clear that we need to continue to do a lot more work in this area, that trans people have been overlooked in the HIV response and actually overlooked in society generally. And it's incumbent upon us to try and change that. Just a few things that really stood out for me was universal health coverage will not be universal until it is extended to everybody and includes gender-affirming care and services for trans people. Stigma and discrimination is still something that we battle all the time, and it continues to undermine everything that we do. As I said, a holistic approach to responding to the needs of trans people, I think, is really, really important. And finally, and this session was a good reminder of that, the centrality and the importance of trans people leading. They need to lead in this area with allies standing behind them and backing them. So SKIPA 2 has been very pleased to host this forum. And we look forward to doing more work with you. I'm also struck by the number of people who attended this session and from the range of countries from Southeast Asia and South Asia. So thank you very much, and look forward to working with you again. Thank you. Matthew, over to you.
Great, thank you so much to all of our panelists for this fruitful discussion. So we are about time for the webinar, but we will be sure to send out the recording as well as any of the presentations or links to the various tools that have been presented and shared by our panelists as well as our presenters earlier in the day. Nikki, I don't know if you want a photo before we close the webinar. Would that be good if everyone can maybe turn their cameras on for a group photo before we end out the webinar?
For anyone's comfortable enough to turn on their cameras, we're gonna have a snapshot. So our team here is going to take a shot. Please. Let me count. 1, 2, 3,